Namaste, and welcome to our continuing series on homeopathy with our beloved Dr. Pachegaonkar. Namaste. We're continuing with the heart, which is very, very important these days for so many people. What would we take up today?
You can take up coronary circulation.
Okay, very good.
See, the heart itself, it's a continuously working organ, and every minute, on an average, 72 times heart has to pump heart. It pumps and relaxes
72 times
per minute.
per minute.
Per minute. And that too, like right from a fetal age, right from being in intrauterine age till death, it has to work. So it's a very important organ and just the size of this fist, but it works tirelessly throughout. And it itself requires regular blood supply, and that is what we call coronary circulation, where the coronary arteries, they supply blood to all the parts of heart. And it's a strong muscle. Heart is having strong muscular layer, and then it is regulated. The beats are regulated by the conduction mechanism. But the circulation is provided by heart itself through coronary arteries to the blood. And many times what happens, either there are plaques from the arterial inner wall deposits, like say when there is atherosclerosis, there is sclerotic change, degenerative change, and those plaques get dislodged and they get lodged somewhere in the coronary circulation.
I see.
And because of that, what happens, there is a sort of this lumen becomes occluded, and there would be stenosis, and there would be lack of blood supply in the terminal part of that artery. So depending upon which area is getting blocked, there would be ischemia, a sort of a lack of blood supply is called ischemia. And in physiological conditions, what happens, whenever there is a chance of little bit of a transient lack of blood supply, there is always a pain. The heart muscles cause pain there because of this lack of blood supply, ischemia. And when pain comes, there is vasodilatation, immediately vasoconstriction followed by dilatation, where more and more blood supply is supplied and dragged, and that is what we call anginal pains. These anginal pains are the cry of the part of the heart to suck more blood, for blood. So in physical way, that's why in anginal pains, even if you don't treat, the person becomes alright, because the blood supply is ensured by vasodilatation and vasoconstriction. So, and therefore, even if you take the ECG, there won't be much changes found out, because it is totally a functional disorder. It's only for a transient moment when more and more blood supply is drawn. See, in body there is a phenomena called as collateral circulation. Collateral circulation means, like, if some area is supplied by one branch of artery, and if there the supply is not adequate for the tissues, then the tissues drag or attract more blood from the surrounding area, and those branches also get activated, and what we call collateral circulation. So if one artery becomes defunct slowly, the function of this artery can be taken over by supplying that area through other branches of the arteries, and that is what we call collateral circulation. Unfortunately, in coronary circulation, this collateral circulation is not as easy as it would be elsewhere, and therefore there is less chance. If much depends upon how the block is formed. In coronary circulation, if there occurs a block, and which is very gradual deposits of sediments in the artery or a branch of coronary artery, And if they are slow, then there will be some sort of inadequate blood supply for a while. And if it is marginally inadequate, then the heart muscles will draw blood supply from the other branches, that area. And slowly, slowly, collateral circulation will be well developed. We have seen some cases, like it's very interesting. We had one, that time, young doctor, it was somewhere in 87, 88. And this young doctor at the age of 34 developed massive ischemic attack. And that time he was conservatively treated with ICU and all, and he recovered in about 3 months. He was given a light duty. He was not allowed to take hard duty in clinics. And he was again given regular exercise and all to build his good circulation. And after 4 or 5 years, he said, no, I want to have my active clinical duty. And then the director of the medical institute said, doctor, you have to go through angiography, check your coronary circulation, and then only we'll allow you to work. And then he did go to Mumbai. That time it was not in every center angiography was done. And he went to Mumbai, and there the cardiothoracic surgeon was telling, young man, you are lucky that you did not come to us when you had heart attack. Because one of your arteries, major artery, is 100% blocked. But 100% collateral circulation is developed, so you don't need bypass. Your nature has done bypass. And then he was perfect. He is still there. He retired from the job and he is fine with that.
Now, in my case, I was walking up the hill and suddenly I felt I was out of breath. And then I sat in the house for a while. Actually, I drove to the post office, got my mail, came back, and something told me, you're having a heart attack. I called my neighbor. He sent the ambulance. They brought me to the hospital. They said every artery was blocked. Amazing, huh?
Yes.
And that's why they had to do the triple bypass.
No, that's what. Actually, fine. As a life-saving measure, that is undertaken. But what I am trying to tell you is even body has that possibility to have collateral circulation.
I see.
Only thing is those conditions should be conducive for that. That's why the best exercise they say to prevent coronary block is exercise.
Is exercise.
This is regular exercise is the only treatment for that. Because once you exercise regularly, the heart develops a very good effective circulation, and collateral circulation also becomes active. And main reason for coronary blocks is the stress. The mental stress is the main reason. Because what happens, any panic or any stress situation leads to vasoconstriction. And that vasoconstriction, however transient, definitely brings about the changes in the inner lining of the arteries, and then the blocks occur. Actually, earlier doctors also used to say that a bad quality of cholesterol getting raised is the main reason. But now we have realized that even high cholesterol also not necessarily will lead to coronary blocks. We have cases here where the triglyceride levels are above 900, 950, and the person doesn't have any block, and for years together. 450, 500 triglyceride level is common. Maybe they have the inherited tendency, but these people, they don't have cardiac block or coronary heart block. We have cases. We have a person working, he is now 76 years now, and he had triglyceride raised to the level of 450. Initially he was eager to take statin, but when we dissuaded him from doing that, he said, okay, I will be on homeopathy and exercise and natural diet. But we asked him to monitor it every 3 months. So initially for 2 years he was monitoring, and he has perfectly normal cholesterol levels. His triglycerides are normal for last 10 years.
And they would always tell me that it was such a serious thing to have this over 300.
Yes, yes.
I used to have it at 250 or so, triglycerides.
Yes, but in that also, if your HDL is good, high density lipid is good, so we always try to tally the levels, proportion. Like HDL LDL ratio, if it is 1 is to 3, then you don't have much chance. I don't think it will have any adverse effect. In even in hypercholesteremia or dyslipidemia, what we call it, even thyroid malfunction can secondarily tamper with these levels. So, but it is not something which is primarily responsible for coronary block. It can be a tendency, inherited tendency also. We have seen somewhere, like if you check me also, coronary circulation, definitely there will be some element of coronary blockage. But physiologically, heart knows how to compensate it by creating collateral circulation. So there are some cardiothoracic surgeons who have been doing this bypass. Later they realized that this is something which is undue, and they stopped. Even I have seen. We met one cardiothoracic surgeon from Hyderabad. After performing cardiothoracic surgery for in thousands in about 25-30 years, he stopped doing it. Now though he used to say, you even don't go for angiography, start getting conservative treatment, regular exercise, breathing exercises, pranayam, and proper sleep and proper lifestyle, and that itself will correct. You don't need to go for even angiography. That's it. I have seen, like when Dr. Kapadia from Ahmedabad, internationally he became popular. He stopped treating coronary block cases with conventional drugs
and surgery,
inserting stent and anything.
I see.
And with mere yoga, pranayam, and healthy lifestyle, used to manage them conservatively, and people did improve. Even their stress test came negative for coronary ischemia. So it is something where if patient's participation is good, so definitely it can reverse. Functionally it can reverse. Maybe the block may not go. Like someone has 60% block, that percent may remain. But the circulation to the corresponding area of the heart will definitely be, completely achieved through collateral circulation.
Now, they took a vein out of my leg and used one of that.
They have to take from you, because they take from others, it won't be accepted by body. It being part of your body, it is accepted. See, as a life-saving measure, I can understand that. Life-saving measure, I can understand. But not in every case one has to go to bypass level.
Very interesting. And so there's been a change in these surgeons, or a number of them.
Yes, I have seen. See, there are cases with, even in medical fraternity also, the best test, we don't go for angiography first. We just advise the treadmill test. A stress test, what we call it. So we ask the person to run for 10 minutes at certain speed on the belt, and then look for the ECG changes. So the person who has a coronary block or somewhere adequate, so there definitely person starts getting chest pain, and that coronary ischemia symptoms come, or even ECG changes indicate that he has a coronary block. But there what happens, some person has not run for say 20 years. 10 minutes running is almost like little more than 2 kilometers.
Yes.
And if person has not run for 10 years, so much distance, definitely many people give the false reading, that they become false positive for stress test. I have seen one lady, my close relative, she said she has chest pain, and she was examined, and little bit of ECG changes came, and the cardiologist advised her to go for stress test. And very next day the stress test was conducted, and they said within 3 minutes they had to abandon that stress test because ECG changes, she became breathless and chest pain came. And when they phoned me, her son phoned me, I told, I know her for last 20 years and she has not been running. So this is not the way how we should go for stress test. For stress test, we advise person to get geared up, like little running, practice. 15 days we ask the person to practice it and then go for stress test. Suddenly, at the age of say 60 or 65, if you subject someone for stress test who has not been running even for a while, see, people as an exercise walk, but hardly people run for exercise.
True.
And in that case, too, we always say that you prepare yourself for stress test and then false tests don't come as positive.
Yes, understand.
So it's a very interesting area, like coronary circulation. But now, every now and then people are going for angiography without much preparation in angio. I have seen very interesting case of this angiography. One retired revenue officer at the age of 65, he was referred for angiography. And he had some ischemic episode there. And when he was referred to angiography, it was being done in Pune. And of course, nowadays they do angiography with the probe inside, so that if needed, we can insert the stent also.
Mm-hmm.
So they were doing, and they did angiography, everything blocked, everything was noted, and when they were retrieving it, bringing it back, suddenly, before taking it out, it got dislodged from the wire. And that apparatus, got dislodged, means in circulation it can go anywhere and block.
Yes.
And the cardiothoracic surgeon was conducting this angiography, got scared, so he called one vascular surgeon, this, that, and then they had to open one artery and take it.
Yes.
So with a very strong magnet, they kept it held in near the femoral artery, everything was ready, and then they suddenly opened it and took it out and sutured it, and he survived. They were so much relieved by that. And imagine, his blocks were there, they were not taken care of, they were just detected, and with this he survived and he lived without any treatment for more than 12, 13 years up to the age of 78, 79. One more case also I remember, like this practicing doctor in periphery, he had heart attack and he was brought to district place Latur in Maharashtra, and he happened to be my student's father. So naturally when he was admitted, they approached me like, can you visit my father? So I visited the hospital. There were ECG changes, some ischemic episode was there. So I told this, anyway he has recovered from the acute episode, but the damage created by transient ischemia for a while would definitely take some time, because there would be a lot of damage because of lack of blood supply for a while. Not only that, during that the blood pressure also lowers down as a physiological action. And there, because of low blood pressure for few hours, even kidneys start failing. And so he had symptoms of even acute renal failure. And we said, you don't need to treat it, it will reverse. Now his heart is functioning well with sorbitrate like vasodilators and all, and so you allow him to recover properly, he should not be under stress. So first thing you do is, you don't allow any relatives to visit him and talk to him. So give him best rest, good nourishment, simple diet, liquid diet, let him recover at least for 3 months. This is what I told.
And the key was no stress.
Yes. So after 2-3 days, when he was brought out of ICU in a normal room, ward, relatives started pouring in. And so many relatives in the town started coming to meet him every day, at least 30-40 people coming, and he was describing. And within 3 days, he had another ischemic attack. In fact, I had given them instruction that you don't allow relatives to reach him. You someone counsel them and send them back without seeing the patient, but they couldn't manage and he had another attack. Then this physician who was treating this person, he told, no, you should go for angiography, it is risky now. It is a second episode right in the hospital he had it, and they took it. Then I suggested, see, going for angiography 300 kilometers away. Anyway, he is doing well. He has recovered from the second episode also. Allow him to recover. Give conservative treatment, allow him to recover. After 3-4 months, you go for angiography. No, not now. But somehow they did not listen to me. But the person who is treating, the physician, naturally they had to. And he was taken to, again, Pune for angiography. And while just performing angiography, the anesthesia person realized that this person is developing stroke in the brain. There is, and when he realized that cerebrovascular accident is there, and then because he was being given vasodilators and all, so there was a hemorrhage in a small branch in brain. Then they rushed him immediately for CT scan before going for angiography procedure, and they found out that a small artery was bleeding, hemorrhage was there. And then they said, nothing doing with angiography, we have to deal with this first. And they treated him conservatively, nicely, and he did with one side paralyzed, the corresponding side paralyzed. And then he was brought with one, that gift of paralysis instead of going for angiography. And then he was fine with that. Like his coronary angiography was not performed. And with that, he started recovering, and even paralysis also. In about 1 year, his paralysis also recovered. He came to Pondicherry later. He came to Pondicherry. His paralysis recovered. He was walking about, and then he said, "I won't go for angiography." He did not go for angiography until he got retired, and he had about 12-15 years of healthy life without going for even angiography. So it's very interesting to learn this.
Thank you so much. Namaste.